Hey everybody, welcome back. I'm Army Pygott, and this is Blood Gas of the Week, case number 9. A 14-month male-castrated Labrador Retriever is presented laterally recumbent and minimally responsive. He's been staying in a boarding facility for the last week and was noted to have picked up the cough that was going around during his stay at the facility. The caretakers have noticed him coughing for the last 2 to 3 days, and yesterday he did not eat all of his food. This morning, he was found in the cage, on his side, unresponsive, prompting his immediate presentation to the emergency service. At presentation, the dog is laterally recumbent and responds only to noxious stimuli, including your attempts to get him intubated. He's cold to the touch, and his femoral pulses can't be palpated. The mucous membranes are cyanotic, and he takes gasping inhalation approximately every 8 to 10 seconds. Within 3 minutes of hitting your stat table, the dog has 2 large-bore IV catheters, a fluid bolus is started, blood's collected with stat labs running, he's intubated with the help of a small dose of fentanyl, manually being ventilated with a bag valve mask on high-flow oxygen, and instrumented for monitoring. As your resuscitation efforts continue, your stat labs come back. So let's talk about this awesome blood gas. This is a venous sample. You could argue that an arterial sample would be better because of the apparent respiratory disease. However, this is what was available with the initial labs. So it's a venous sample, and we're going to move on to the acid-base assessment. The pH is severely low at 7.03. This is an acidemia, and it's a really bad one. Acidemia can be caused by a high PCO2 or a low bicarbonate. As it turns out, our patient has both, so he has a respiratory acidosis and a metabolic acidosis, 2 primary processes. Since this is a mixed disturbance, we can't really calculate or expect to see any obvious compensation, so we're just going to move on from here. So if you prefer the tic-tac-toe method, we see the pH is low, which is an acidemia. The CO2 is high, which means we have a respiratory acidosis, and the bicarbonate is low, which means there's a metabolic acidosis. Now we see what lines up with the pH. In this case, it's all of them. So we have a mixed disturbance, and both of the disturbances are acidifying processes. So our final blood gas diagnosis is a mixed acid-base disorder characterized as severe acidemia due to a combination of metabolic acidosis plus a respiratory acidosis. When you see this combination of findings, the severe acidosis with both a respiratory and metabolic acidosis, you should be thinking about intubating your patient if you haven't already. We would expect a patient this severely hypoxic to have a very high respiratory rate and consequently to have a low PCO2, in other words, breathing off his CO2, making it low. The high CO2 suggests either he's got a failure to ventilate, meaning he isn't breathing enough or he isn't breathing deep enough, or a failure of his gas exchange because his lung disease is so bad. You won't actually know for sure which one or if it's a combination in the initial stages of your resuscitation. You just have to treat and see what happens. The dog was hypoglycemic, in shock, and exhausted. And once his hypoglycemia and shock were treated, his respiratory rate and depth increased dramatically. But in the interim, he needed assistance with his breathing. This can be accomplished with a mechanical ventilator or by manually ventilating using a bag valve mask. Sometimes we call these an ambu bag in veterinary medicine, or by hooking him up to an anesthesia machine and having someone deliver controlled breaths using the bag on the machine. By temporarily breathing for him until he's improved enough to take back over on his own, you can reduce the severity of the respiratory acidosis and reduce the chance of a cardiac arrest due to severe acidosis. It doesn't matter where you practice, whether you're in a day practice, a mobile practice, a specialty practice with all the bells and whistles, it doesn't matter. If you can intubate a patient wherever you work, you can do this and you can assist the breathing temporarily. So again, our final diagnosis here is a mixed acid-base disorder with a combination respiratory and metabolic acidosis causing severe acidemia. Until next week, keep the rubber on the road and the blood inside.